going to be doing some ostomy care, so I'm going to perform hand hygiene. I'm going to introduce myself to my patient and ask her name and date of birth. After she tells me that, I'll just confirm on her wristband to make sure I have the correct patient. And then I'm going to make sure that she's safely in the bed. Her bed brakes are on, so I'm checking for all my safety measures. And putting on my gloves. And for ostomy care, you want to ask your patient if she has any allergies, and you want to verify that there's an order. You want to explain what you're going to be doing, so you're going to tell her that you're going to be performing ostomy care. You're going to be cleaning around her stoma and changing out the bag. So here you can see she's got an old bag on. You want to take a look, and sometimes it'll be dated on the bag, sometimes it'll be in the chart of when it was last changed. So you want to take note of the date and time that it was last changed, and you want to look and see if there's any drainage around it, because that can cause irritation to the skin. So it looks like, we'll say this bag was 2 days old and there's nothing around the skin, no drainage, anything like that. It's nice and snug on there. So now I'm going to grab my supplies, and you want to put down an absorbent pad just so that you prevent getting anything on her skin or on the bed sheets. Alright, and then you'll use this graduated cylinder to empty the bag. And you want to do this before you change the actual bag, because otherwise you'll have contents all over. So we'll empty that. And we'll say there's 50 milliliters of contents in there. You want to take a look at the color, consistency of it, and then dispose of it in the toilet. After you do that, you can come back in, perform hand hygiene, and put on a new set of gloves. So then you'll explain to your patient that you're now going to take the bag off, and you're going to take a look at the stoma. When you look at the stoma, you want to make sure that it's nice and pinkish red. And I'm going to get everything set up here so that after we take the bag off, we're ready to go. So I've got my washcloths, my scissors. We'll take the bag off of her, and then for learning purposes, we'll use this stoma. We've got our wafer and our new bag, and then barrier paste, skin prep, and then our measurement guide. This wafer is really nice because it already has everything outlined for us, but if it didn't, some of them are just blank, so you would need a pen to mark with the measurement guide. All right, so I'm going to take this bag off. Just click that off and dispose of the bag. And then I would take off this wafer. This one's stuck on there pretty good, but you would take the whole thing off, and then once you do that, you would use warm water, and you're going to clean the skin around the stoma. You want to make sure that it's nice and clean so that the skin's not irritated. And then you want to pat dry. Get it nice and dry, or the new bag won't stick on there. All right, so we've done that. And now we can put the clean one on. So we'll go ahead and measure. We're going to measure this one. And when you're measuring, you want it to be about 1/16 of an inch bigger than the actual stoma, so that one's going to be too tight. So this one looks good. We'll do the 1 inch 3/4. You can see there's just a tiny bit of room around the stoma, so it's not constricting it, but it's also not going to have a lot of skin exposed around it. So I'll go here and I will cut to my 1 3/4 line. You'll also want to make sure you have the absorbent pad down there just in case anything starts leaking from the stoma. Okay, cutting this extra stuff off. And now that we've let, excuse me, now that we've let our stoma dry, we'll put the skin prep on and the barrier paste. I'll just pretend to put that on. Let that dry a second. And you want to remove this backing. Now my gloves are all slippery. And you put that around the stoma. And you want to hold it down for a minute or so, just so that it sticks to the skin nicely. Once you do that, you can stick the actual bag onto the flange. Sometimes they can be kind of tough to get in there. So you really want to make sure that it's locked in so that nothing leaks out. Okay, now that we've got that on, you can take the backing off of this so that it sticks to the skin real nicely. There we go. Okay. You want to press that all down, make sure it's on there really tight. And then this one came with a clamp, but if it didn't, you just put it on the bottom of the bag. And clamp it shut. And there you go. So now you'll clean up all of your supplies. And once you do that, we can take this off, and she'll have her new bag on. I'm gonna take my dirty gloves off and perform hand hygiene. And then I'll ask my patient if she needs anything, make sure that you put the bed back down. She's got her call light and her water. And then you're gonna document in the computer, and you wanna make sure that you document the date and time that you did it, the procedure that you did, the type of pouch that you changed, what type of skin barrier you put on, and the amount of output that you had in the last bag, and the skin condition of the stoma and then around the stoma, and if you did any teaching for your patient. And that's all.